How does an ESR blood test relate to lymphoma? Have you ever wondered how a simple blood test can provide insights into complex diseases like lymphoma? The erythrocyte sedimentation rate, or ESR, is a blood test that measures how quickly red blood cells settle at the bottom of a test tube over 1 hour. This test is important because it serves as a nonspecific marker for inflammation in the body. In the context of lymphoma, particularly non-Hodgkin lymphoma and Hodgkin lymphoma, an elevated ESR can indicate the presence of cancer-related inflammation. Lymphomas can cause systemic inflammation, which leads to the production of proteins in the blood that increase the aggregation of red blood cells. This aggregation results in a higher sedimentation rate. Therefore, when a patient has active or bulky lymphoma, their ESR values are often elevated, reflecting ongoing inflammation and tumor activity. While the ESR test alone cannot diagnose lymphoma, it can support the suspicion of the disease when combined with other clinical signs and laboratory findings. For instance, patients with lymphoma typically have higher ESR levels compared to those with benign conditions or other types of cancer. This can help differentiate lymphoma from non-malignant causes of symptoms, potentially reducing the need for more invasive diagnostic procedures. Moreover, ESR can serve as a prognostic tool. Higher ESR levels at the time of diagnosis may correlate with more extensive disease or a worse prognosis, especially in Hodgkin lymphoma. Additionally, monitoring ESR levels during treatment can provide valuable information. A decrease in ESR may indicate reduced inflammation and a lower tumor burden, suggesting that the treatment is effective. However, it is essential to recognize the limitations of the ESR test. It lacks specificity and sensitivity, meaning that elevated ESR levels can occur in many other conditions, such as infections, autoimmune diseases, anemia, and other cancers. A normal ESR does not rule out lymphoma, and elevated ESR alone cannot confirm a diagnosis. Therefore, it is used alongside other tests, such as a complete blood count, lactate dehydrogenase levels, imaging studies, and biopsy. In summary, the ESR blood test is a useful, nonspecific marker of systemic inflammation and disease activity in lymphoma. It aids clinicians in the diagnostic process, assessment of disease severity, and monitoring treatment response. However, it must be interpreted within the broader clinical context. If you suspect lymphoma or have concerns about your health, always consult a healthcare professional for a comprehensive evaluation and personalized advice.